You know, there's something I've been thinking about a lot lately, something that doesn't get talked about enough when we hit our 60s, 70s, and beyond. It's the idea that sometimes the very things we rely on to feel better might be quietly working against us. Have you ever picked up a prescription, taken it faithfully for years, and then wondered, is this still the right choice for me? Or maybe you've noticed new aches, fatigue, or even confusion creeping in, and you're not sure why. Well, today, let's have an important conversation about medications. Not to scare you. No, that's the last thing I want to do, but to empower you, because knowledge is the first step toward taking control of your health. Now, I'm not a doctor, but what I can do is share what I've learned from experts, research, and conversations with folks just like you. Together, we'll talk about 8 medications that for some people might do more harm than good as we age. And more importantly, we'll discuss the questions you can ask your doctor to make sure your prescriptions are still working for you, not against you. Let's start with the first one, something many of us have in our medicine cabinets. Number 1, benzodiazepines. You might know these as medications like Valium, Xanax, or Ativan. They're often prescribed for anxiety or trouble sleeping, and they can feel like a lifeline when you're in the middle of a stressful chapter of life. But here's the thing. Studies show that long-term use of these drugs, especially as we get older, can increase the risk of falls, memory problems, and even a shorter lifespan. Our bodies process medications differently in our 60s and 70s than they did in our 40s. What once felt helpful might now be slowing you down or making you foggy. So, if you've been on one of these for a while, it's worth asking your doctor, is there a safer alternative for me now? Maybe cognitive behavioral therapy for sleep or anxiety, or a lower dose option? Next up, non-steroidal anti-inflammatory drugs, or NSAIDs. These are your ibuprofens, naproxens, even some prescription strength pain relievers. If you're like me, you've probably reached for these after gardening or overdoing it on a walk. But here's the catch. Long-term use can lead to stomach ulcers, kidney damage, or even heart issues. And if you're already on blood pressure medication or have kidney concerns, the risk goes up. Now, I'm not saying toss your Advil bottle today, but if you're taking these regularly, talk to your doctor about other ways to manage pain. Maybe physical therapy, topical creams, or even lifestyle changes could reduce your reliance. And the third medication we need to talk about, proton pump inhibitors, or PPIs. Names like Nexium or Prilosec might ring a bell. These are for acid reflux or heartburn, and they're everywhere. But research suggests that using them for months or years can interfere with nutrient absorption. Things like magnesium and calcium, which are critical for keeping our bones strong and our hearts healthy. Plus, they've been linked to a higher risk of infections. If you've been on these for a long time, ask your doctor, can we try stepping down to a lower dose or a different approach? Sometimes simple changes like eating smaller meals or avoiding trigger foods can make a big difference. Now, before we go further, I want to pause and say, if you're taking any of these medications, please don't stop them abruptly. That can be dangerous. This isn't about fear. It's about starting a conversation. Your doctor knows your unique health story, and together, you can decide what's best. And hey, if any of this resonates with you, maybe you've had an experience with one of these medications, I'd love to hear from you in the comments. Your story could help someone else feel less alone. And if you're finding this helpful, consider giving the video a like or sharing it with a friend. It's how we keep these important conversations going. Now, let's keep this conversation going, because the more we know, the better choices we can make. Remember, this isn't about alarm bells, it's about awareness. So let's dive into the next 3 medications that deserve a closer look as we age. Number 4, anticholinergic medications. Ever taken something like Benadryl for allergies or a nighttime sleep aid? Maybe even a prescription for overactive bladder or certain antidepressants? Those fall into this category. Here's the catch. Anticholinergics block a chemical called acetylcholine, which is vital for memory and muscle function. As we get older, studies show these drugs can increase the risk of confusion, dementia, and even hospitalization. They're sometimes called the anti-aging pills you don't want because they can age your brain faster. If you've been relying on these, even occasionally, ask your doctor, is there a non-anticholinergic alternative for my condition? Sometimes, simple swaps, like a different allergy med or bladder treatment, can protect your sharpness. Next up, sulfonylureas. If you're managing diabetes, you might be on medications like glyburide or glipizide. These work by squeezing more insulin out of your pancreas, which can be great for blood sugar control, until it's not. The problem? They can cause blood sugar to drop too low, especially in folks over 60. Severe hypoglycemia isn't just shaky hands. It can lead to falls, confusion, or even heart issues. And here's the kicker. Newer diabetes medications are often safer and more forgiving. So, if you've been on one of these for years, it's worth asking, is this still the best option for me? Or could we try something with a lower risk of lows? Your future self will thank you. Number 6. Antipsychotics. Now, this one's tricky. Medications like risperidone or quetiapine are sometimes prescribed off-label to older adults for sleep, anxiety, or agitation related to dementia. But here's the hard truth. The FDA warns that these drugs can increase the risk of stroke, heart issues, and even premature death in seniors with dementia. They're like using a sledgehammer to crack a nut. If you or a loved one is on one of these for non-psychotic symptoms, have that tough but important talk with the doctor. Are there gentler behavioral therapies or non-drug approaches we could try first? Sometimes adjusting the environment or routine can ease agitation without the risks. Now, I'd love to hear from you. Have you or someone you care about navigated these medication changes? Sharing your story in the comments could help others feel less alone. And if you're finding this helpful, don't forget to hit like or share this video with a friend. It's how we spread knowledge that truly matters. We've got 2 more medications to discuss, and one of them might shock you. It's something many of us take to stay healthy, but in certain cases, it can backfire. We'll tackle that in our final conversation. Until then, keep those questions coming, and remember, your health is worth advocating for every single day. All right, friends, we've come to the final part of our conversation, and I want to thank you for sticking with me. These last 2 medications are critical to discuss because one of them is something many of us take preventively, thinking it's protecting our health. But in certain cases, it might be doing the opposite. Let's dive in. Number 7, low-dose aspirin. Now, this one might surprise you. For years, many of us were told a daily aspirin could prevent heart attacks or strokes, and for some folks, that's still true. But here's the twist. As we age, our blood vessels become more fragile. That same aspirin that thins your blood to prevent clots can also increase the risk of bleeding in the stomach or brain, especially if you're over 70 and not at high risk for heart disease. The guidelines have changed, and what was once routine isn't right for everyone anymore. So, if you've been popping that daily aspirin, just in case, ask your doctor, is this still necessary for me, or could the risks outweigh the benefits now? Sometimes stopping it safely under medical guidance is the healthier choice. And finally, number 8, statins. These cholesterol-lowering medications, like Lipitor or Crestor, are lifesavers for many. But here's the nuance. As we get into our 70s and 80s, especially if we're dealing with multiple health issues, the side effects, like severe muscle pain, memory fog, or even a higher diabetes risk, can become a bigger burden. For some seniors, the benefit of lowering cholesterol decades into life isn't as clear-cut. Now, I'm not saying statins are bad. They're not. But if you've been on them for years without a recent review, it's worth asking, is this still the best fit for my current health? Could we reassess my dosage or need? It's all about balancing risks and rewards. Now, I want to pause and say, if any of these 8 medications rang a bell for you, take a deep breath. Knowledge isn't meant to scare us. It's meant to empower us. You don't have to make these decisions alone. Your doctor is your partner in this. The goal isn't to toss your prescriptions out the window. It's to start a conversation. And speaking of conversations, I'd love to hear from you. Have you or someone you love adjusted medications after 60? What worked or didn't? Drop a comment below. Your wisdom could be the nudge someone else needs to speak up at their next appointment. And if this series has been helpful, please consider liking the video, sharing it with a friend, or subscribing to the channel. Every click and comment helps us create more content that matters to you. To wrap up, let's remember, aging isn't about fearing every pill in our cabinet. It's about staying curious, asking questions, and honoring the incredible life experience we've earned. You deserve to feel informed, heard, and in control of your health, no matter your age. So here's to making choices that let you savor every sunrise, every laugh with grandkids, every moment that makes life sweet. Thank you for trusting me with your time today. Until next time, take good care and keep thriving.